The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, you know, it's already February and we need to talk about your Medicare benefits again. We have a great show planned for you today with all the updates you need to know, all the things you need to know about the helping programs, and some great information about how you can reach out and just find a good advocate to help you get through the maze of Medicare. We have so much to tell you about and a great guest, so stay tuned.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare Preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
No one likes to have to ask for help. It's a courageous act.
Sarah Solomon, Energy Share Coordinator.
Our clients work hard, sometimes at 2 or even 3 jobs, but still struggle to keep the heat on. They're doing everything they can. They're proud and they don't give up. I feel inspired and honored to work together with these Montana families.
To donate, call 888-779-7589 or go to EnergyShareMT.com. Energy Share, you can help your neighbor stay warm.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
It was a beautiful day. There was about 2 square feet of ice near the door, which I slid on and fell, cracking one rib. And I became somewhat frightening for me to walk outside, particularly in the winter. The Stepping On program came as kind of a surprise to me. I didn't know about it. I've learned the importance of proper balance. I think anybody who has fallen or is afraid of falling would benefit from this program.
Hi folks, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimmy Everman, and as I said up front, we have a great show planned for you today. We're going to get the year started off right and talk all about your Medicare benefits, what you can expect, maybe some helping programs that are in the mix, and just what you should know about Medicare as you kind of step through the year of 2021. Today we have with us a great guest, Janet Stillman. Janet, welcome.
Thank you.
Janet, you are the State Health Insurance Assistance Program, or SHIP, and you're here in Helena at the office. And you are a great SHIP advocate. I want you to tell us, first and foremost, what is SHIP? Because it kind of doesn't sound like what it really is.
Right. Well, thanks for having me. SHIP stands for the State Health Insurance Assistance Program, or SHIPS, as we're known across the state. Every state has some kind of SHIP program. In Montana, we have over 200 SHIP counselors located all throughout Montana, every county. They may not live in the county, but they cover that county. So our traditional aging network has been with the Montana Area Agencies on Aging throughout the state, which we have 10 of them. There are SHIP counselors located in all 10 of those area agencies on aging. Mm-hmm. And we also have, in the last few years, reached out to have advocates, SHIP advocates, counselors in community health centers, independent living centers, hospitals across Montana. Just a lot of different places that we hadn't traditionally had them.
Yeah.
So they are there to help Medicare beneficiaries with their Medicare.
Okay, so tell me this, because we want to make sure we're clear right off the top. Are these guys paid by, a insurance company, or how are they advocates that we would want to go to?
Well, our State Office on Aging, we get a SHIP grant from the Administration on Community Living. We contract with the area agencies on aging, and that's in Montana. Most of our SHIP counselors are paid. However, those ones in the community health centers and the independent livings and nursing homes, hospitals, they're doing it in kind. So as part of their job, because they've come across so many Medicare questions, they just wanted to have the knowledge and reached out to get trained and be counselors.
Right, and just, I mean, we want to be sure folks know that there's nothing, as one of our other hosts would say, on the shelf for them to sell. They're there to be an advocate, and that's it. They're there to, and what, they don't make the decisions for you, correct? I mean, you sort of work with them as a SHIP counselor.
Right, and they lay out the options, and they explain things for them, lay out their options, but we as SHIP counselors, we don't tell somebody what they need to do.
Right.
You know, it's up to them. It's their decision, and we are not insurance agents,
right.
So we can't recommend one thing over the other.
Right.
But we're just there to really help and to help guide them and show them their options and educate them.
Yeah. So what about 2021? Is there anything big news in 2021 about Medicare, Janet?
Well, some of the big changes, one of the big changes was for Medicare Advantage plans. Prior to 2021, if you had end-stage renal disease, you couldn't pick up a Medicare Advantage plan. You had to stay on original Medicare, and that was your only option. But beginning January 1st of 2021, you can be in a Medicare Advantage plan if you have ESRD. So that's a big change. And sometime with Medicare Advantage plans, there's, you know, it's still Medicare, it's just a little bit different than traditional Medicare. But it also, one of the big things is it has a maximum out of pocket, where traditional Medicare 80-20 split all the way across could go on forever. Mm-hmm. Where Medicare Advantage plans, one of the nice things about a Medicare Advantage plan is that there's a maximum cap out of what somebody would have to pay. So that's, you know, not been really fair to them, these people that suffer with that. So this year it's exciting that they can get into a Medicare Advantage plan if they decide that's what's right for them.
Yeah, and I think we want to just mention, you know, that the Medicare Advantage plans are called Advantage for a reason. They may have some extra benefits that are especially important to a person, and so that's a great move forward for folks that might want to have a slightly different way of getting their Medicare.
Right.
You know, and before we finish off this segment, Janet, I just want to talk a little bit about Mymedicare.gov, because that's a biggie for folks. Can you tell us about it?
Right. It's a Mymedicare.gov. That's where you go to sign up for an account. It's a safe site. Your information's confidential. It's got good encryption to keep your information safe. So some things that you can do on Mymedicare.gov is you can track your claims faster. So you can go in there and look at your claims. I don't think it's not like real time, but it's, you know,
but almost.
It's faster than waiting for the information to come in the mail. The other thing you can do is save and track your prescriptions. So you can go back, it keeps the last year of your prescriptions that you've purchased, and so you can go there and review them and see what you've been on over the year, or, you know, have a current list of what your medications are. And you can also learn about Medicare's Preventative Benefits and see what you may qualify for, just, you know, looking in your account under a personalized account.
Wow, those are great resources, Janet. Thank you so much for talking about that, because I think Medicare.gov, you know, people maybe don't want to go to a website, but it's a good one, and it's pretty easy to use.
It is.
So thanks for that. And when we come back, we're going to talk more about preventative benefits and also COVID, because of course we're still in the middle of our pandemic, and you want to know what Medicare is doing to be proactive while we're all trying to get through this very difficult time. So stay with us. We have a whole lot more to talk about, and don't go anywhere.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
3,000-pound walrus? Good insulation. 10-pound Sphinx cat? Bad insulation. Puffed up cardinal? Good insulation. Naked mole rat? Oh, bad insulation. If your home's insulation isn't all that it could be, the Low Income Energy Assistance Program may be able to help. Call today. You just might be eligible for weatherization assistance, and that could make your nest a little cozier.
Hi folks, welcome back to Aging Horizons. We're here talking about Medicare today with Janet Stellman, the State SHIP Director. Janet, glad to have you.
Thanks for having me.
Want to go back to just a couple things before we move on to preventive benefits and Medicare and COVID. And one is a really big new thing in 2021 is the senior savings model. Can you talk about that?
Right. Well, earlier in 2020, the Trump administration looked into and started the senior savings model, where some Part D plans will cap certain insulins at $35 a month.
Okay, and Part D is the prescription drug piece.
Right.
Okay, go ahead.
So certain insulins are in certain plans will cap your insulin at $35 a month. So that can be, you can look into that with a SHIP counselor. Or you can also go to Medicare.gov or Mymedicare.gov to your account and go to the plan finder and look for these plans that might include the senior savings model and see if that will change your drug costs. And if there's an opportunity for you to change if you want to.
Yeah,
so
that would be great. And also just getting a better deal price-wise on your insulin is going to be an awesome.
Right, because we know it can be really expensive. So.
Yeah. And what the other thing I wanted to ask you about before we moved on is the open enrollment period for the Medicare Advantage plans, because you had talked about that a little bit, but we didn't talk about to folks about how they could sign up.
Right. So January 1st to March 31st every year is the Medicare Advantage open enrollment period. So during this time, you can change to a different Medicare Advantage plan. So if you're in one Medicare Advantage plan and you're not real happy in that one, so you want to look at another Medicare Advantage plan, you can do that between January 1st and March 31st. The other thing you can do is maybe you're not happy in your Medicare Advantage plan and you want to go back to traditional Medicare. You can go back to traditional Medicare during this time and look at a Part D plan with your traditional Medicare. So that will take effect the first of the month after you make that switch. So a SHIP counselor can help you with that, or you can go to mymedicare.gov, your personalized account, and find drug and health plans on the plan finder.
Great. That's a great option. Thanks, Janet. Yeah. Now, what about the preventative benefits? Because that's always been a biggie for Medicare and really great resources for the beneficiaries.
Right. So Medicare Preventive Benefits, they want you to stay healthy. So they offer a couple of great benefits, well, many benefits, but two of them specifically we're going to talk about is your Welcome to Medicare preventive visit that you get once in the first 12 months that you are first have Medicare Part B. So these Welcome to Medicare benefits or visits are free if your provider accepts Medicare. The visit includes a review kind of your family history, your medical history, your social history related to health, and education and counseling about preventative services are available to you. So some of the things that you might get during that appointment is a flu or a pneumonia shot. They'll check your height and weight and your BMI, do a simple vision test. They'll talk to you about advanced planning, and also depression screenings, and you'll come out of there with a written plan of what, where you're at and where you want to be. So the second big one is your yearly Medicare wellness visit every year. So it's just kind of a follow-up to that Welcome to Medicare that you had, but now you're looking at what you've done over the last year and where you're going from here. So it updates your personalized prevention plan to help prevent disease and disability, and it also takes a look at current risk factors that you might have in your life. Your provider might also perform cognitive impairment assessment just to make sure that that things are going okay and you don't maybe need some additional help. So those are the two big preventative benefits that I wanted to talk about today. The other thing is the Medicare and COVID. What is Medicare covering with COVID? Well, Medicare is going to cover lab tests for COVID-19. You pay no out-of-pocket. Medicare covers the FDA authorized COVID-19 antibody test to see if you've had COVID, see if you have antibodies to it. It's also going to cover that monoclonal antibody treatments, so that little cocktail you might get if you're hospitalized, and that could help your symptoms and get better. Medicare is going to cover the COVID-19 vaccines. You pay no out-of-pocket. So whether you're in traditional Medicare or Medicare Advantage, that is going to be paid for. So even the Medicare Advantage plan, everything's going to be billed towards original Medicare for that COVID vaccine. So check when you're scheduled to get it, and get it if you want.
And just talk with your physician about because
what's best for you.
Because we're all scheduling and that kind of thing. That sounds great. And one thing I did want to mention before we close out this segment is, what about, because I've been reading about people getting phone calls that they should buy a COVID test, that they should get on a list for a COVID vaccine and such, and it's not Medicare, it's just...
They're not going to call you and say, you need to sign up for this test, or you need to send us your personal information. They're not going to call and do that. It's going to be up to you and your doctor to talk about that.
Okay. Well, folks, we have a whole bunch more to tell you about Medicare. Don't go anywhere. We want to tell you about the helping programs. We'll be back in a minute.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline Montana.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Hi folks, welcome back to Aging Horizons. We're here talking with Janet Stillman today about Medicare. Welcome back, Janet. Now there was one other part of the COVID and Medicare issues that we wanted to talk about before we move on. That's telehealth.
Right, and so Medicare's through this pandemic is paying for expanded telehealth services. So you doctors, nurse practitioners, clinical psychologists, licensed clinical social workers, physical therapists, occupational therapists, speech language. So all that can be done from the comfort of your home instead of taking the risk to go out and be infected with COVID. So it's been a pretty positive thing, and people are really liking it. I know we have similar ones with our health insurance through telehealth, and it's actually works out kind of nice. So.
Yeah, it's a surprising thing to me how much I like it, as opposed to thinking I need to go to the doctor's office every time.
Right.
So that is awesome. I'm so glad to hear that. So let's talk a bit about helping programs, because obviously not everybody is going to have all the means to have this, to get all they need from their Medicare benefits. Is there any assistance with that, Janet?
There is, and one of the great things about our SHIP counselors is these are really important programs to them, because they know how important it is to the beneficiary if they get assistance. So the first one is low income subsidy or extra help, or maybe you'll hear it LIS. That is through the Social Security Administration. What those benefits are is it's help with your Medicare Part D, your drug benefits. So if you're eligible, it could mean reduced co-payments, it could mean no deductible, just a lot of help. It could save lots of money. So you may, if you weren't on it, maybe your prescription was $50 a month. If you're eligible for low income subsidy, your prescriptions might be $3 to $8 a month.
Wow,
per
that's
prescription.
So worth it.
So it's a big savings, because we know that medications are so expensive. So that is through the Social Security Administration. The next program is the Medicare Savings Program. So the Medicare Savings Program is, you might have heard of them as QIMBY, SLIMBY, or QI. These are administered through the state Medicaid office. However, a SHIP counselor can help you apply for a Medicare Savings Program too. So what these are is there are different levels. QIMBY, QMB is the Cadillac model of it, I call it. It's for the lowest income resource people, and what it covers is it will cover your co-payments and deductibles for Medicare A and B. It will pay that Medicare premium every month for you. If you're somebody who doesn't have enough work quarters and have a Part A premium, it'll pay your Part A premium.
Wow.
So a big savings. And if you're on Medicare, traditionally, like I said, it's an 80-20 split, or with Medicare Advantage, you might pay 15, whatever. But with QIMBY, QMB, it acts like a supplement to Medicare, and it's going to pick up everything.
Sure.
So it's really a great plan. So that's the QMB program. The second one is SLIMB or SLMB. This has a little bit higher income limits allowed, and what it pays is just the Medicare B premium.
Every month?
Every month.
Okay.
So that's $146 something a month.
Yeah.
I mean, that's a big savings for people to be able to have a little bit of extra money in their pocket to go do things that are important to them.
Right.
So,
right.
The third program under the Medicare Savings Program is called Qualifying Individual, or QI. It has higher income limits for people. And again, it only covers the Medicare B premium, so that $146 per month. The difference between it and Slim B is there's a little bit higher income limits, and you can't be on Medicaid for that program. So whatever that reasoning is, I think it has to do with the funding, but it's a little bit extra, or lets you make a little bit extra and still qualify for that program.
Right. That's just awesome. And also mention about the extra enrollment periods people get from those.
Right. So low income subsidy or Medicare Savings Program, if you're on those plans, you can change your plan quarterly if you'd like. So if you're in a plan, whether it be a Medicare Advantage plan or a prescription drug plan, and you don't like it for whatever reason, you can change once a quarter. So 3 quarters of the year, the last quarter is actually open enrollments for Part D, so that's your option that time. But it gets you out of a plan that may not be the best plan for you, or maybe a plan that you're not happy with. So those are big bonuses for being in those programs. So.
Yep. And what about Big Sky RX? That's one we love.
Yes, Big Sky RX is a homegrown program, as you always used to say.
Yep.
It's funded by tobacco tax, and what it does is it gives those people that usually don't qualify for programs. It has quite a higher income limit that you can make to qualify, and it'll help pay your Medicare Part D premium up to like $35, right around there, $31 to $35. So it's not a big savings, but it's a little bit. I mean, if you do $35 a month times 12, that's $400 a year that you're saving. So.
And when you're on a fixed income as a person who's either disabled or a senior citizen, that's going to take a lot of pressure off. That'll, like you said, they can do something else. They can pay another bill. Whatever.
Right.
Janet, thank you so much for all your information today. I hope you'll come back and see us again. Thanks so much for all you do for the state. And let's just shout out to those SHIP counselors again.
They are great.
They are great. Folks, call your SHIP counselor. They can help you. They are objective. They have nothing to sell you. For Aging Horizons, I'm Kim Yeverman.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.